Welcome to this session of the Intuitive Medicine Summit, where we'll explore ways to intuitively participate in our own healing. I'm Lisa Bunnies, your host, and my guest for this session is Marie Manuchehri. Our topic today is healing with help from the other side. Marie Manuchehri, RN, is an internationally known intuitive healer, speaker, author, and teacher. Her compassionate presence allows people to heal their wounds and emerge into expanded consciousness. Along with her private practice, she offers workshops and retreats and hosts a popular radio show where energy and medicine meet. Marie is the author of Intuitive Self-Healing and How to Communicate with Your Spirit Guides. And we're going to talk about all of the above in just a minute. Marie, thank you so much for being with us today. Welcome.
Oh, thank you so much. It's a pleasure to be here with you, Lisa.
Well, it's always a pleasure talking to you, Marie, because we always have the greatest conversations. And I love that we're talking about getting help from the other side for intuitive medicine type healing, sensing into your own body, et cetera. And that's sort of a bit of a shift of perception, isn't it? Why do you think this shift in perception is paramount to healing?
Well, I think any shift of perception is paramount to healing. I think that's one of the main things I do with my clients. I have them see things differently, which can change their particle perception and start to move energy in their body and have their bodies start to self-heal. But I think we don't, first of all, a lot of healers and intuitives, we don't always let others help us. Most of all of these people that I just mentioned are empathic and old souls and know how to do everything all on their own and are fiercely independent creatures. And yet there's this beautiful, group of beings that live outside, of the human realm that know how to heal faster and better than humans do. They have better modalities than we do. They live in higher vibrations of energy than we do on the earth realm. So they perceive energy in a very different perspective. Plus they can see everyone's past lives. Once you cross over, you have access to look at anything and everything that your own energy based on your frequency will allow you to. So beings who live on the other side can see things, especially people's loved ones. They would be curious about a person that they are no longer hanging out with because they're living in a different dimension. But if they became ill, especially seriously ill, they could become curious about their past lives, their own relationship. And if they can see a dynamic where they could offer messages or a movement of particles to make a quick shift in someone's energy system, they would love to participate in that. So I think we have to learn to become more receptive and even more vulnerable, which I think is the true essence of power. So we can allow that energy to come forward in a way where it's easy for the participation to occur.
Mm-hmm. Now, from my understanding, and please correct me if I'm wrong, that's why I'm asking the question, is that folks from the other side aren't allowed, for lack of a better word, to interfere, to butt in where they're not invited. Do we have to ask for help, or is there a way for them to help without us, imploring, please help me?
Well, everyone's kind of an independent contractor. All souls are independent contractors. So let's say that my Aunt Bertha was ill. Let's just say my Aunt Bertha is deceased, by the way, but let's just say she was alive and she's ill. And let's say I was doing energy work for her. And let's say her great uncle is deceased and wants to be helpful. It's really going to be between her and him. Healers are kind of, they're like mediums, we're conduits. We allow energy to pass through. But he's in a higher vibration of higher self energy. So of course her higher self is going to go, that would be great, please do. So they're kind of having this non-verbal telepathic conference that's coming through. It's the human that goes, who is that person? Why are they helping? Why do they want to help? What's going on here? Humans are so curious and we guard ourselves and we don't let beings help us, physical or otherwise. But yeah, the being on the other side knows immediately. They wouldn't even try to help if there was, for instance, some reason why it shouldn't occur, but that's rarely the case. I had this really interesting situation where someone came to see me and They came for healing. And the woman said to me, by the way, if my parents come through, I don't want to talk to them. That's the first time anyone has ever said that to me. I'm like, okay, all right, sure. That was a request of the client, and I respect my client's choices. So we're in my healing room. And of course, her parents are right there, front and center. I don't say a word. I don't say anything. I mental telepathically commute to them and say, thank you for being here. And they're sending her positive energy. They're very kind, very loving and gracious to her. Almost towards the end of the session, she goes, if my parents are here, I do want to talk to them. I said, great. And then they had this beautiful conversation, and she was able to cry and have a lovely talk with them and let them apologize or just tell her how much they love her. Does that answer your question?
It does. It does. Thank you. Yes. So we do have free will in whether they can butt in or not. So yeah, but if they do have like really pressing information, and if we do have that resistance, I don't want no. Do they just go, okay, I'll wait until you're open?
Absolutely. They're extremely respectful. I've never had a situation where someone, let's say, who's crossed over and they were unkind to the person that I'm treating. And if they haven't changed, if their energy hasn't changed, if they hadn't had the consciousness, the shift that they needed, they can't go into that energy. They can't even affect them. They're on the outside. And sometimes I'll say to someone, oh, I see your dad on the outside of your auric field. He can't come through. So I'm assuming you had a very difficult relationship. And then the person will tell me, and I go, well, he hasn't changed his energy enough yet, but he's working on it, because the dad will tell me, I really want to be a more compassionate person. I'm working on it. And I'll go, okay. But yes, they just can't. The laws of energy are very profound, but there's more love and compassion and understanding and acceptance than humans would like to believe.
Interesting. Well, you've obviously had helpers from the other side assist you in energetic or medical diagnosis, or we wouldn't be talking about this today. I would love it if you would share a few more stories. This stuff is fascinating.
Yeah, I had a client who came to see me, a woman, probably in her 40s. And I used to have people meet in my living room before we went into my healing room, because I've always worked from home. And I would talk to them about energy medicine, just in case they didn't want to be there, because I wanted to make sure they really wanted to be there. I've had two people go, I don't want to be here. I'm like, okay, you can leave. It's fine. You don't have to stay. While I'm speaking to her, I see a man standing behind her who's on the other side. And I asked her if her father had passed, and she said yes. And I said, did he work in the medical profession? And she said, yes, he was a radiologist. And that was kind of the end of our conversation. He said some niceties towards her, but I didn't see him during the session. But he came back while I was in session with other people for years and years and years and years, and offered me guidance if someone needed a CT scan, if indeed what I was seeing was accurate. I called him David. I don't even know what his real name was, but I knew who he was because I saw him around his daughter. I thanked him profusely. Beings don't even have to help if they don't want to. It was something that he wanted to do, that he felt called to do. So for years and years and years, he would come and offer me support. One of the times that he came, I was working with a young person who had just been diagnosed with an advanced or highly aggressive form of rectal cancer. And when I was looking at his body, and he had already had the tumor removed, he'd already been to the doctor, but I could see that the tumor had been encapsulated, meaning that it hadn't emerged out of the intestines. It hadn't affected him. It was like surrounded by tissue. So it was really protected. And I said to him, was your tumor encapsulated? And he said, it was. And I said, okay, well then, in my opinion, you don't need chemo, right? And because that's a whole nother conversation I have with clients all the time since I worked in oncology. And his wife was in the room with him when I was working on him. And she said, that's what I said. But he really wanted to have chemo because he was really scared. He was young, he had young children. I always support all the decisions my clients make. The chemo that he was going to get was very, very aggressive. Like I've never even seen that type of chemo before. They infuse it through the spine, actually. So David, who showed up in the room, and he said, yes, you're right, it's encapsulated. Yes, I think he would be perfectly fine without chemotherapy. But he said to me, but he's going to choose it, which we all knew. And he goes, why don't you help him to have magical experiences when he's in the hospital? Because he'll have to stay in the hospital for like a week at a time for each treatment that he had. So that's what we worked on the rest of our sessions, because to me, he was already cured surgically. It was removed. There was no metastasis. The tumor again was encapsulated. And so we worked on him having magical experiences so that he could transform any fear or anxiety he had. He actually had a friend who had passed away, and through our work together, he was able to communicate with this person while he was in the hospital, which brought him so much delight and happiness. So there are many, many ways that I've worked with beings on the other side, depending on what the client might need, but David was extremely helpful. I haven't seen him in a while. I don't know if that's because I don't need him, or is he off doing something else? I don't know. Maybe if I ask for him, if I am curious, maybe he'll show up. But I was so gracious every time he came. It was almost like he could tell that I was a little unsure or maybe a little nervous or something. He would just show up and be of incredible help. And he was 100% accurate in
Wow.
every situation that I had.
I love stories. Thank you. You mentioned that you worked in oncology, and for people who might not be as familiar with you as I am, would you go ahead and give us that story of how you? I recall you talking about not really realizing you had this
Yes.
ability as a medical intuitive until.
Yeah, so I was raised very holistically, and through some joyful experiences I had, I decided to go to nursing school, which still my mother thinks today, even today, was not a good idea because she's so holistic. And through very weird circumstances, I ended up on the oncology floor in the hospital because that's not where I originated, but I'd actually had palpitations in my chest. And I saw one of the cardiologists because it had been happening for months. And he did a whole bunch of blood work on me. And I wore a pack to do EEGs or EKGs on my heart. And he said, your heart's normal, but your biorhythms are off. I was working graveyard, and the only day shift available was the oncology floor. So I transferred to the onc floor. And it was during that time that I began to have psychic and intuitive experiences. I began to see and hear and feel what was happening to my patients on a cellular level inside their body. I would be standing at the bedside and someone's liver would talk to me and tell me what was going on with it. And their liver enzymes were elevated, probably because of the medication we were giving them. But there's also emotional reasons. Those are really the core reasons why people get sick and why they don't heal, unless it's time for someone to cross over. Of course, it's never the wrong time. Souls choose when they want to leave their bodies. So I was very blessed because I eventually went to my nurse supervisor to tell her I was having these multisensory experiences every day, and they were mounting every single day. I was seeing dead people. I mean, everything was happening. And she said, you're seeing energy and you need to start laying your hands on our patients. So I did. Even 3 separate physicians ordered me to work on their patients when I said I didn't have time. They didn't want to know what I was doing, but they said, could you go do that thing that you do? And when I would say I'm too busy, they wrote orders for me to work on their patients. I was just very blessed, something I'm meant to do in the world, and started to practice about 2 years after laying hands on patients in the hospital. And I've been full-time for over 20 years.
So they wrote a prescription for Marie.
Literally. Yeah, literally.
That's fantastic. Now, do you suppose there was a reason that you were placed, for lack of a better word, by the universe in the oncology wing?
Mm-hmm. Well, first of all, I really love medicine, which I didn't know until I started to work with it. And I also love transformation. And when you're working with people who are given a challenging diagnosis, all of our patients were inpatient. So I didn't work in outpatient. I worked in people who were having lots of serious health issues or reoccurrence of their cancers or things of that nature. People with us for weeks and weeks or months. And I think that during those time periods, archways open up all over the place where beings from the other side are walking back and forth, and healers and loved ones. There's a lot of activity going on. And I think that's what prompted my intuition, along with the obligata, which is the primitive aspect of the brain. It's a very intuitive aspect of the brain. a lot of times it can get activated during trauma. And that's why some people, their intuition works really good during trauma, but not when everything is going great in their life, which is not a bad thing to have, by the way. So even though I wasn't personally experiencing trauma, I was around, traumatic things happening all the time for family members or the patients or whatnot. And I think that combination ignited my insight.
Interesting. Wow, this is fascinating. I hope you don't mind if I continue to pursue this. I visited loved ones in hospice where they were actually in the hospice. They weren't, at home with hospice workers. And there is an atmosphere there where I think if you're even slightly sensitive, you can feel that it's not just physical humans in that building. There are plenty of um, folks from the other side, I guess, for lack of a better way of saying it, either they're comforting or waiting or, whatever it is that they're doing. So because cancer I think it's probably one of the most serious illnesses that humans are, I mean, blanket serious that we're dealing with. Do you suppose that that's another reason that you were thrown into that world specifically? Like you were just tossed into the deep end?
Yeah, I also loved it. I really believe that people should follow their joy. And you're really correct about the hospice situation. It is a very busy multisensory experience. In fact, when I mentored students, I recommended that they volunteer for hospice to allow their psychic ability to expand because they're just inundated with the energy the entire time. Plus, it's really a cool and interesting honor to be at the bedside of someone leaving their body. It's really fascinating, even if it's someone you deeply love. If you can detach for just a few moments from the grief and experience the expansion of energy, there's really nothing quite like it, in my opinion. So I also loved it, and I think people need to follow their joy. I miss the hospital still every day, but I love what I do now more. So following joy helps us to expand into our natural gifts and talents.
Yeah, absolutely. I agree with you 100% there. And I hate to turn this in the other direction, but have you had any negative experiences?
I never have. No, it's never been my experience whatsoever. No, I've I've never been afraid or uncomfortable or yeah, felt low frequency energy. In the very beginning of my career, I would definitely see what do they call those? Oh, like entities, sometimes attached around like the root chakra or around people's bodies. Uh, but I think because I work with pretty aware, conscious being people, I rarely see an entity. And really people just need to be grounded to avoid entities. Entities come when no one's home, when people aren't present. Just like if I were to leave my house and leave the doors open, the deer would come in and the bunnies, and it's like a welcome mat. So, and of course, entities are just to me mischievous energy. They're actually quite cute, but that would be the most interesting thing along those lines that I've seen. But even when I've seen what some people would call, determine as scary, I've only seen it as beautiful and interesting and from a very different perspective. So I've never been frightened or anything like that.
I really like that perspective because I think, there's so many TV shows about, this type of topic, and they're always scary. And so, I mean, even the word entity makes you think, oh, Netflix. So if somebody does have an attachment like that, does that cause illness, or what happens to the body when you've got that type of thing?
It's such a good question, a great question. It hasn't been my experience that the entity attachment caused the illness. Illness has a lot to do with misperception. However, you need to have a lot of energy coming into your body to stay healthy. So having detachments would not be healthy because they draw on someone's energy. They're being fed by that person's energy, kind of like a leech, if you will, right? So disease is there to help people transform, whether that is they leave their body or they stay in their body. They change their perception. Everyone who I know who's even healed from horrific diseases, and luckily I've witnessed many people do that, I'm so proud of them. I always give all my clients all the credit because I believe people heal themselves. they've changed their perception drastically. They look at life very differently. And so there's something within their being that knows that the illness could potentially wake them up. Like some people will never be concerned if they get an illness. They don't worry about health. Their body recovers very quickly. So maybe it'll be their finances. If they want to have a transformative experience and they're not consciously growing, maybe all of a sudden they'll lose all their money, or they'll lose a job, or a family member might pass away that's really distracting for them and forces them to do inner work. So the universe knows where to push our buttons and what's going to potentially affect us, but we've asked them to before we incarnate to Earth. We say, okay, if by age such and such, usually 40, but let's just say if by age so and so, because it could be any age, if I can't figure it out, you can pull the rug out from underneath of me and I will hopefully do some inner work.
Oh, I have so many questions. What I would like to back up just a bit here. I've heard people say that my disease, my illness, my cancer, et cetera, was the best thing that ever happened to me, along the lines of what you were just talking about, because without this dire predicament, they would not have experienced this awakening. And, my thought is, I don't want to know that badly. I don't want the 2x4.
It doesn't have to be an illness, by the way. Like when I look at you, I don't think that your challenges come from illness. That's just my perception. Because I work with people who are completely healthy too, or just have a few aches and pains or whatnot. So it could be something else. But you don't have to be hit over the head by a 2x4. You have to learn to be present and be curious, which you are. You're an extremely curious person. You ask questions all the time. And the universe kind of starts gently. And remember, we've asked them to do this. When beings come to the earth to have an experience, they're working on things that they've been working on for maybe hundreds of years. And they've tried it in non-physical realities, and they still haven't figured out what they wanted to figure out, like self-love or self-empowerment or compassion or whatever it is. So they go, okay, I'm going to go to earth because I can probably figure this out in 50 earth years, which is about 5 years on the other side. So it seems like a really short period of time. And so we go, okay, I'm going to come to earth. And then we forget our past lives and what we want to, learn. But then we choose circumstances before we're born so that those situations come to light for us. So it doesn't have to be a 4x4, but you have to pay attention. I had a client once. I'd worked on her for 16 years. I mean, really, she's still a client of mine. But at the time, I'd seen her for 16 years. And I saw her regularly, like once a quarter. And she had developed, which I didn't know, a very small early stage of breast cancer. Like it was a 0 to a 1, so a very early stage. And I didn't know that she had it in her body. And I said, I'm so sorry, I didn't see this. I'm very sorry. And she goes, well, on our very first session, you said that you were worried about my chest area and that I needed therapy. And I never did do therapy. And she still hasn't had therapy. Luckily, she just needed, a lumpectomy, and she's perfectly fine, thank goodness. So there are things that are happening to us that we don't want to pay attention to, or we don't want to ask the hard questions. A lot of people are afraid of their magnificence. That's really what people are afraid of. They're really not afraid of disease or loneliness or not having enough money or working too hard, because most humans are like that. I always think of humans, and I hope this doesn't seem like disrespectful, but kind of like cockroaches. We can survive just about anything. We can do things lonely, broke, sick, and sad. But can we do things in our magnificence? And so that's really the part we want to pay attention to. Am I being called to my magnificence? Of course, everyone is being called to their magnificence. Everyone is creative. Everyone has natural intuition, at least for their own self. But everyone has beautiful gifts and talents. Everyone has something in their life that would make them extremely joyful and would also allow them to have beautiful relationships and incredible wealth in their life. Like that's normal, but that's what we're afraid of, is our magnificence. So that's the part we need to be questioning. Am I in resistance? Am I afraid to be an incredible being of light living here on the physical realm? Am I terrified of knowing the truth of my magnificence? Those are the things we want to look at. And the universe is just pulling little threads of the blanket or the rug before it really yanks it back.
Well, what exactly do you think people are afraid of? Is it that I mean, the things that come to mind for me is that either they won't fit in with, the general population anymore, they'll become invisible, they'll levitate. What is it that they're afraid of?
They're literally afraid of their magnificence. They're scared of their God self. They're terrified. They would prefer to think negative things of themselves. Very few people even love themselves. Most people loathe themselves. So that's what they're really afraid of. I remember when I read one of my favorite books written by John Randolph Price. He was an early spiritualist, and he wrote a book called The Super Beings. And I was reading it. It's a small book. I read it still today, and it's written in kind of old English. And I was 20 at the time, and I was worried that if I awakened myself, that I'm going to have to go live in an ashram, like in Tibet or something, and be far away from my family and friends. And I could hear at that time, it took me a while to realize I was intuitive, but I could hear at that time that the earth has changed so drastically. You could sit on a toilet and be very spiritual. So it was basically telling me I wasn't going to have to move to Tibet. Not that that would be a bad thing. Now that sounds actually delicious, So literally, we're afraid of how wonderful we are. We're afraid of being adored and loved and cherished. We're afraid of being special and wonderful. I mean, if you are, multisensory, which I think almost everyone who listens to the Shift Network has awareness and consciousness and has gifts and talents and practices them even. It's a popular thing in today's popular world. We have television shows about it. So if someone doesn't want to be with you or hang around with you or be friends with you because you now are different, you don't want them in your life anyway. You don't want them around you, and you'll attract really wonderful people. And when you have the essence of yourself, whatever you allow yourself to have, you never feel lonely. You feel surrounded by the divine. You meet wonderful people at the perfect moment, whether you're on vacation or a coffee shop. You have interesting, powerful, fulfilling conversations. It's a very different thing when you dance with your magnificence.
Well, what's coming to mind, I assume you've seen The Lord of the Rings, the scene where Frodo offers the ring to Galadriel. And, up until he does that, she's this, ethereal being. And then she's being offered this ring, and all of a sudden she's like, ah! So I think sometimes that's something we're afraid of, is that if we were allowed access to our full power, would we handle it responsibly?
I think that's a whole nother myth in itself. Because people are so afraid that they're going to move into their ego, but most people don't understand the true definition of ego. So real ego, not what Webster's dictionary says, is fear. So anytime we're in fear, no matter what it is, fear that I was going to be late to get on the Shift Network as I was putting on my lipstick and putting the curling iron through my hair, and my assistant's going, "You have 5 minutes," and that's me and my ego. Feeling that we are beautiful, handsome, smart, deserving, worthy, lovable has nothing to do with the ego whatsoever. We want to be as close in terms of understanding ourselves as to how God, creation, source, the universe, sees us. That's how we move into alignment. So thinking that we're magnificent, when you think that authentically, you don't feel like you have to prove it to anyone. I mean, obviously, I'm talking about myself and my abilities during this conversation. But when I'm out in the world, I don't have those conversations. I just feel them within myself. I feel delighted and happy and grateful and excited. I also know that it's true for everyone else. And I only wish that everyone would embrace and feel that they're magnificence and believe in themselves and fall in love with themselves, because then we could talk about it, which would be really nice.
It would be really nice. I would like that. But I want to go back to what you were talking about. One of the people you've worked with who didn't follow your advice.
Yeah.
And I can see how sometimes, you get a reading from somebody, whether it's a medical intuitive or just a straight mediumship, whatever it is, a type of reading you're getting from somebody where either it doesn't resonate in the moment, or it's something that you really just don't want to hear. Whatever the reason is, you don't believe in what's being offered as truth. Is there a way for us to set that aside and allow the truth to actually settle in?
Sure.
So you can hear it?
Sure. Well, I think if someone's offering you something that's pretty normal and you have resistance towards it, like getting therapy, that's a kind of a normal thing these days. It's not unusual. That you should at least investigate it, dance with it, ask yourself, why do I have this resistance? I think that should be the number one thing. But what will help individuals to have less resistance is self-love. So let's say, for example, let's say, Lisa, that I said, I think you should go and get oxygen therapy for 6 months. Let's just say I said that to you. It's very expensive. So I've actually never told anyone to do that as of yet, although it sounds really good. So maybe I will. But let's just say I told you that. And you calculated that it was very expensive, and you're like, oh gosh, I'm not going to do that. That's too expensive. That's time consuming. So what I would recommend that you do in that moment is to sit with yourself and be extremely loving with yourself. Just, Lisa, I love you. You're the most incredible person I've ever seen in my life. I want you to, I think people should talk to themselves that way. That self-nurturing is self-love. If you have pets or children, or you have a favorite mountain, the amount of love you have for any of those things is an example of how much you need to love yourself. So you have a moment where you love yourself, and then maybe, because sometimes things don't translate exactly, right? They don't always translate exactly. Maybe in that moment, you'll hear a different translation of what that person really meant, because sometimes intuitives don't even know exactly what they mean when they are giving advice. Right? Sometimes we don't always know because we're channeling information. But if you can sit down and just really, really love yourself in that moment, and then ask, please express to me what is in my highest good about oxygen. And then maybe you'll hear that it would be imperative for you to start breathing into your belly, that you only breathe into. Breath is extremely powerful, right? Learning how to breathe, taking a Pilates class where you're learning how to breathe, or a yoga course. So I just think that if you love yourself when you're hearing that, either you're going to get the correct translation, or you're going to understand why it would be so good for you. But the most important thing to remember is that you have free will. Everyone on the planet has free will. Nobody has to do anything that anybody says. I always tell my clients all the time, you never have to do anything I say. And I mean it completely. But if you love yourself, if you're in that hesitation, like, why did that person say that? And I don't want to do that. And you're some sort of resistance, the self-love will dissolve the resistance. And there's multiple ways that things could be managed, or things could be done differently. Does that make sense?
It does. It does. And this sort of tracks back to a question I asked earlier about if the information is coming from loved ones on the other side, and that's what I don't want to hear this. This doesn't resonate, whatever. If they're the ones who offered the information, is there a different feeling to that? Is there, again, I'm just trying to, because we need to use our own intuitions. We can't just depend on an intuitive. We need to learn to do this for ourselves. How would we then tune into the loved one who is giving us this information to verify?
I 100% agree. People need to learn their own insight and how it works for them, and trust them. That's something I teach all the time. I think it's imperative. Typically, the other side is so smart. That loved ones who are really meaningful will show up. I once had a client, I didn't even know that she smoked cigarettes. I had no idea. She must have changed her clothes and brushed her teeth before she came for a session. And I'd seen her off and on for years. And I was laying my hands on her, and 3 of her aunts showed up. All 3 of them. And apparently they were her favorite aunts, and they were all deceased. And they told me that she smokes and she needed to quit immediately. And I go, do you smoke? And she looks up, she goes, yeah. I go, you do? I mean, I had no clue. I treated her family. I had no clue that she smoked. And I go, as you know, your answer here, they just told me you smoke, and they said you need to quit immediately. And she said, I've had that feeling. I have that feeling. So many times when you hear something that's the truth for you, you already have some sort of insight into it. And the universe is working on your behalf to make it more tangible, or to make more sense, or for you to believe that what you're hearing is authentic. And I said to her, I go, I think you should get help, quitting, because she'd been smoking for years. She did quit, by the way. And she's still here today. So thank goodness for that. But her aunts could tell even beyond my ability, because people on the other side don't have any barriers. They can see deep into the body. They don't have any form of resistance, or their resistance is so much less than the human resistance. They can see very accurately. And they could probably tell that her cells were going to make some change pretty soon if she continued to smoke. And she said she loved and respected them so much she would do whatever she needed to do to quit smoking.
Wow, that's a potent message. I used to smoke. I know how hard it is to quit. So yeah, they must have really gotten through to her. Wow.
Her favorite ants.
Yeah.
Favorite ants.
Wow, that's so cool. I'm watching the clock here. I want to make sure we fit everything in here. I want to make sure that I mention your website, and that is energyintuitive.com. What will people find if they visit your website?
Well, that I teach. I love to teach. Of course, I teach on the Shift Network. I'll be teaching this fall. We'll know more about that soon. And I also teach on my own platform, mini classes and coaching, like for psychic ability, energy healing, mediumship, vibration, which is really important to learn how to run your own frequency and to run it high. I think is extremely important, especially when you want to develop multisensory abilities. You want to run your energy at a high level. I also see clients, although I typically book out over a year in advance. So, keep that in mind. But if people have serious health issues, we do put them on a cancellation list, and those are the people we fit into the schedule as soon as possible.
Mhm. Well, that's good to know. Thank you for that. Wow. Um, Gosh, I would love to keep you on the horn forever, but I don't want to just keep pushing my own questions in here. Is there anything that I've forgotten to ask you, or that maybe is coming to mind now that, or David's showing up?
Actually, I can feel his energy in the corner of the room. This is the second house I've lived that he's traveled with me, like where he's shown up. And there's one area of the room where he shows up and I can feel his energy. And so I am going to translate. You're very intuitive, my dear, by the way. He says that working with humans is an honor and a delight. And he wishes that more people would be open so that those with medical expertise or those with energy movement expertise could easily and effortlessly help healers, whether you're trying to heal yourself, a family member, or your clients. That he says it's an honor and a delight and something very easy for him to do.
Very good, very good. So, how do we get our own David? Is there a number we dial?
Well, I did make a bonus meditation on that, by the way, so that people can allow others to come in, because we never know who could be helpful. Just like that one client, it was her aunts who, I didn't even know she was smoking, right? Who came in. I think what's important is to remember to be open and to recognize that the other side is only here to be helpful, and only those who want to be helpful will apply for the job. And that it's a sacred relationship. And if you could step into that relationship and reduce your resistance and allow yourself to hear, see, or feel the multisensory world's desire to help humanity evolve. Because remember, we're all one. So if the human race evolves, which we do ultimately, I know it doesn't always feel like it sometimes, but we do, that helps the rest of the other non-physical realities to evolve, because we're all one. As they evolve, then we evolve too. But when you're part of the lower string of the vibrational energy, our evolution really creates a strong impact. Right? It's kind of like fresh soil. If the bottom of the soil is moldy in a pot, it wouldn't matter how fresh the other layers of soil are when the roots grow to get strong. So when the bottom part of the soil, which I say that about Earth, but I mean no disrespect. I love Earth. It's one of my favorite time-space realities. But when it is super healthy, then the rest of the universes grows in expansion. So we need to trust and recognize that everyone's here for our highest good. And they only see us in the light of the highest good. They never see us in any negative energy whatsoever. And also the people that we treat, our loved ones or our clients.
Right. Wow. Well, thank you, Marie. This, as usual, just such a fun conversation. I enjoy spending time with you. Thank you.
Thank you, Lisa. It's mutual. You're wonderful. Thank you so much for taking the time to speak with me today.
Absolutely. And I want to remind everyone, I've been talking with Marie Manucherry, and I want to thank everyone for joining us. I hope you enjoyed this conversation in the Intuitive Medicine Summit.